Hi, I'm Jen Scanlon. I am a holistic nutritionist with my master's degree. I wrote my thesis on Hashimoto's thyroiditis, and I am also an FDNP, which means I have advanced training on running and interpreting functional lab tests. Today, I'm going to talk about some common thyroid patterns I see in lab work so that you can have a little more education and understand your thyroid labs just a little bit better. Today, I'm going to go over some of the thyroid lab markers, what they mean, and optimal ranges, which are not the same as the normal ranges that you'll get from the lab. And then I'm also going to talk about some thyroid lab patterns. There's 7 of them that I'm going to go over. And for each one, we're going to do an overview, what your lab results might look like if you have that pattern, common causes, some support strategies, how to dig deeper using other lab work, and then a little summary of each at the end. Let's get started. So the first thing I want to make clear is that patterns do not exist in isolation. Thyroid dysfunction is not just about your thyroid. It's not just a thyroid issue. When you are chasing numbers on a lab report by increasing and decreasing meds alone, that's not going to be enough for most people to make a big difference in symptoms. So please remember that your labs tell a story, but they're only part of that story. When we work on the basics of diet and lifestyle, we can shift our thyroid pattern fairly quickly if we're doing the right things and know what to look for. And as you heal, you may need some changes in your thyroid medications, so always follow up with your doctor and retest often. As always, the information I'm going to present is for educational purposes only. Please work with your doctor so that you can decide what is right for you. All right, so let's start out by talking about thyroid lab work. These are your blood labs. Lab ranges on your lab work that you're going to get back where it says you're high, low, or normal. The normals on these are based on population averages. That includes people with thyroid disease. So if we're just taking the average of everybody who ever took the test, that's not going to tell you where people actually feel good. So functional medicine ranges are based on where people actually feel best. And that's what we're going to aim for because we don't want to be average. We want to be optimal. So on the next few pages, when I talk about the thyroid labs, I'm going to give you an optimal range, and that is the range that studies show that people feel best. We do adjust these every once in a while, so I'm going to give you numbers to use now, but things can change as science evolves. So just keep that in mind that these are the ranges that we're working with now. Not every functional practitioner agrees, but they're usually fairly similar in their optimal ranges. So first, let's just talk a little bit about how your body decides how much thyroid hormone to make. It starts in the brain. The hypothalamus is a part of your brain. It releases a hormone called thyroid releasing hormone that stimulates a different part of your brain, the anterior pituitary, to release TSH, thyroid stimulating hormone. We measure this a lot. Some people only measure this, and we will talk about why that's not a great idea. The TSH tells your thyroid, hey, you need to make some thyroid hormone. The thyroid makes mostly T4. It does make a little bit of T3. T4 can be converted into T3, mostly in your liver and your gut. And then there is what is called a negative feedback loop, an inhibitory feedback loop. When your body senses that it has enough T4 and T3 in circulation, a signal goes back to your brain that says, hey, don't release so much TSH. So your TSH will go down if your thyroid hormones, T4 and T3, go up. So that's essential to understanding why these patterns exist, because with these thyroid dysfunction patterns, something in this loop or this chain of events gets messed up. And we will talk about things that can cause the breakdown in communication as we go on. So let's talk a little bit about the actual thyroid labs. The first one we're going to talk about is TSH. Remember, TSH is the signal from your pituitary gland down to your thyroid, is made by the brain to tell your thyroid to produce hormones. High TSH means lower thyroid function. Low TSH means you possibly have an overactive thyroid. The problem with only looking at TSH is it doesn't tell us what your actual hormone levels are. It just tells us what your brain's telling your thyroid to do. Do we know if your thyroid's actually doing that? No, not unless we look at other markers. So the functional range for TSH where people feel the best is around 0.5 to 2 micro IUs per milliliter. The next lab markers we're going to look at are free T4, which is thyroxine, and free T3, which is triiodothyronine. So first, free T4 is the storage form of the thyroid hormone that is made by your thyroid. It needs to be converted into T3 to be usable. The thyroid makes mostly T4 and only a little bit of T3, so most of what your thyroid makes does need to be converted. The functional range for free T4 we want is 1.4 to 1.8 nanograms per deciliter. For free T3, this is the active thyroid hormone that gives you energy. It makes your metabolism go and gives you your good mood and all those other good things that happen when your cells have energy to do what they need to do. If you have low levels of free T3, you are going to have hypothyroid symptoms. Even if your TSH is normal, you are still going to feel symptoms. The functional range for free T3 is 3.4 to 4.4 picograms per milliliter. Now, you're also going to see total T4 and total T3. This number includes both the bound, which is the inactive form, T4 and the T3 that are bound up in your bloodstream and not able to be used, plus the free, which we just talked about, the free usable hormones. So it's the total, all the hormones in your bloodstream, whether your body can use them or not. Functional ranges for total T4 are 6 to 11.9 micrograms per deciliter, and total T3 is 120 to 180 nanograms per deciliter. Usually, we want to pay more attention to free T4 and free T3 because that is what is available for your cells to use. Total T4 and T3 gives us a little bit of a more nuanced picture of what's going on, especially if we also measure thyroid binding globulin, which we're going to talk about in a few minutes. But just for basics, if you want the most basic thyroid lab that's going to give you good information, we want to look at TSH, free T4, and free T3. Now, reverse T3 is another excellent thing to add on to thyroid labs because this one tells us a lot about how your body is using your thyroid hormones. Reverse T3 is the inactive form of T3. Your body makes this when it's stressed or inflamed, and it acts like a brake on your metabolism. It blocks the cell receptors that T3 would actually bind to on your cells, so T3 can't get in there. It's clogging them up. So T3 can't get in there and make your cells do work. Ideally, we want our reverse T3 to be super low, ideally less than 15 nanograms per deciliter. Some say less than 9. 9 to 23 is a range I've heard recently, but basically we don't want a lot of reverse T3 around because that means our body is slowing down our metabolism for some reason. Thyroid antibodies, TPO and TGAB are the ones we're going to measure if we want to rule out Hashimoto's, and TSI is one to measure if we want to rule out Graves'. Thyroid peroxidase is the enzyme your body uses to make thyroid hormones. So if you have antibodies to TPO, that means your body is attacking that enzyme and making it harder for your body to make thyroid hormones. Thyroid globulin is like the little storage factory of the materials your body uses to make thyroid hormones. So if you have antibodies to thyroid globulin, then that means that they are attacking your thyroid hormones storage protein. If TPO or TGAB are high, that signals that your body is attacking its own tissue, either the enzyme or the protein, and that indicates that you likely have Hashimoto's thyroiditis. That means your body is attacking your thyroid tissue. On the other hand, TSI are antibodies that mimic thyroid hormones. So they bind to the receptors and make your thyroid produce more thyroid hormones, causing hyperthyroidism. And that is an autoimmune form of Graves' disease. We'll talk more about Hashimoto's and Graves when we talk about the patterns, but the goal for all of these is as low as possible. We want them below detectable levels. So the next lab that is really informative is thyroid binding globulin, that is abbreviated TBG. It's a protein that carries thyroid hormones in your blood. I put a little bus there because I like to think of it as like a little bus that your little thyroid hormones get on to go to work. So if we have a lot of TBG, we have less free hormones because they're tied up in riding the bus. They're stuck to that protein in your blood. That is often tied to estrogen dominance or using birth control. Low TBG, on the other hand, can possibly point to liver issues or high testosterone. The goal for TBG varies by your lab. We're actually going to go by the lab normal range on this one. The last one we're going to talk about is T3 uptake. This shows how many binding sites are open on a thyroid binding protein like TBG that we just talked about, like how many seats on the bus are open. It helps us see if thyroid hormones are too stuck to the bus or if they're too free floating. Low T3 uptake is linked to high estrogen or high thyroid binding globulin, and high T3 uptake is often linked to insulin resistance, PCOS, or high androgens. The goal for men is 32 to 34%, and for women is 28 to 34%. Let's move on to the thyroid patterns. Grab your labs, look at the optimal ranges on all of these, mark if it's high, if it's normal, or if it's low according to optimal ranges, and then match up your highs and lows to these patterns and see what's going on. So the first pattern we're going to talk about is primary hypothyroidism. In primary hypothyroidism, your thyroid isn't producing enough hormone to meet your body's needs. Your body, like we talked about, has that feedback loop when it comes to thyroid hormone production. If thyroid hormone levels are low, your brain ramps up the TSH to try to push your thyroid harder. It's like your brain is shouting at your thyroid, hey, make more hormones, we need more hormones. But with this pattern, the thyroid gland itself can't keep up. So on your lab work, you're going to see that your TSH is high. Your brain is screaming at your thyroid, make more. But your free and total T4 are going to be low, or maybe on the very low end of the normal range. And then your free and total T3 are also going to be low. Antibodies on this case are likely to be normal. Possible reasons or drivers of primary hypothyroidism are injury to your thyroid, surgery, radiation, trauma, if you got hit in the neck really hard, something that has destroyed your thyroid's ability to actually make thyroid hormones. Other things that can cause primary hypothyroidism are environmental toxins. Some chemicals, heavy metals, and mycotoxins can impair thyroid function, so it just cannot make the thyroid hormone that it needs to make. A third thing that can happen is you may be deficient in some nutrients that your thyroid needs to make your thyroid hormones, like iodine, selenium, zinc, iron, even vitamin D and B vitamins. There are a lot of nutrients that go into the whole production and conversion of thyroid hormone. So for this particular cause, if you don't have those raw materials, no matter how much your brain is yelling at your thyroid to make thyroid hormone, if it doesn't have the materials to make it out of, it's not going to be able to do it, right? So if you determine you do have primary hypothyroidism, here are some lifestyle and diet supports that might be helpful. You're going to want to emphasize whole, nutrient-dense foods so you can replete those thyroid-supportive nutrients. Eat a balance of protein, healthy fats, and colorful produce to support overall hormone health. Reduce your toxin exposure. That means filter your water, use cleaner household and personal care products, and eat organic whenever you can. If you have mold in your house, get that taken care of. If you live near a golf course or a farm, those toxins can be really harmful to your thyroid. Do what you can to avoid them. Filter your air, filter your water. You just want to reduce those exposures to toxins as much as you can. Support your detox pathways. Eat a lot of cruciferous vegetables. Get adequate hydration, do some sweating if you can, like a sauna or even a hot bath every night, and get some movement in. If your thyroid just physically cannot produce hormones because it has been damaged, then you are going to need to replace those thyroid hormones. If you'd like to dig deeper into why you might be showing up with primary hypothyroidism, we'd want to look at nutrients like iron, vitamin D, B12, folate, magnesium, selenium, zinc, and iodine to see if your thyroid has the materials it needs to make thyroid hormone. We might want to look at a GI map or gut zoomer for gut infections, dysbiosis, or inflammation that might be blocking nutrient absorption. And we also might want to test some toxins to see if you have heavy metals or chemicals that are damaging your thyroid. To sum all that up, primary hypothyroidism is when your thyroid gland itself is under functioning because it is either injured, it's depleted of raw materials, or it is impacted by toxins. We want to address the root causes with this by supporting it with proper nutrients and reducing inflammation or toxic burden. And that can make a significant difference in both your labs and your symptoms. The second pattern is pituitary suppression. So remember, your pituitary gland in your brain signals your thyroid to make hormones by releasing TSH. If your pituitary is suppressed, inflammation is messing up that signal. So instead of TSH increasing to push the thyroid, everything's low. The issue here is that chronic inflammation, which can come from gut infections, mycotoxins, other toxins, or other systemic stressors, is dampening the entire feedback loop. Everything's low. So your TSH is low, your free and total T4 are going to be low or low normal. The free and total T3 are going to be low, and antibodies are also going to most likely be normal in this case. Possible drivers of pituitary suppression. Almost always there is a inflammatory component to this, and things that can cause a lot of inflammation are chronic infections, viral infections, bacterial infections, parasites. Mycotoxins are hugely inflammatory, so if there's mold or water damage where you live or work, look into that. Other biotoxins, chemicals, heavy metals, and even lipopolysaccharides, which are toxins on some gut bacteria that can cross if you have leaky gut and get into your bloodstream and cause systemic inflammation, which ties into the gut dysfunction, like I said, which can lead to systemic inflammation with those LPS or by letting through more triggers for your immune system. And then just an increased systemic inflammatory load, which can come from chronic stress, from trauma, from unresolved illnesses like Lyme or Epstein-Barr, from food sensitivities like I just talked about. There are a lot of things that can cause inflammation in our bodies, and figuring out where that inflammation is coming from and how to support our body is key to resolving the pituitary suppression pattern. Lifestyle and dietary supports for this pattern are to focus on an anti-inflammatory diet. That usually means paleo style. So you want to be eating clean, grass-fed, pasture proteins, a lot of colorful produce, organic if possible, especially Dirty Dozen, go for organic. Some good healthy fats, and we want to minimize processed foods. We want to support our gut health with fiber, probiotics and prebiotics, if those are tolerated. It depends on where your gut health is at the moment. And then we would also want to lower toxin exposure whenever possible. Again, filtered water, clean air. Our food, we want it to be organic, personal care products as clean as possible, and check our home environment for mold. We want to prioritize sleep and stress resilience. Nervous system regulation here can play a huge role in reducing inflammation. And then getting some movement. Gentle exercise, not overtraining, but gentle exercise can help lower inflammation without stressing yourself out further. Digging deeper for pituitary suppression, we might want to look at inflammation markers. We could run a GI map or gut zoomer to identify gut infections or dysbiosis, look at leaky gut, total tox burden testing to look at mold, environmental toxins, and heavy metals, and then the food sensitivity testing to identify inflammatory triggers that are coming in with our food. So overall, pituitary suppression happens when we have inflammation that is so high it's blunting that signal from our brain to our thyroid. So instead of pushing harder, the body just slows everything down. It's like, I am overwhelmed. We don't need to make more energy. And that ends up leaving your thyroid hormones low across the board. To resolve this pattern, we want to look at addressing inflammation and uncovering all the hidden sources of inflammation, like gut issues, toxins, infections. Once we uncover those hidden sources of inflammation, that is key to resolving the pattern. All right, the third pattern is underconversion. This was mine for a while. So in underconversion, your thyroid is making T4, but your body isn't converting enough of it to active T3, and active T3 is a hormone your cells can actually use. So if you are in this pattern, you end up feeling hypothyroid, even though your TSH and your T4 can both look normal. Your brain is trying to keep up. Your TSH isn't suppressed, but inflammation, stress, or other imbalances are blocking the conversion process of T4 to T3. This can happen in the liver or the gut, or when there are conditions in the body where your body is intentionally slowing down your metabolism, like if you are having cortisol issues, or you're under a lot of stress, or if you're not eating enough calories. So on labs, this is going to show up as a normal TSH, a normal T4, but your T3 is going to be low. Your reverse T3, if you can get that checked, is going to be high. Antibodies are going to usually be normal. You might start to see some pop up if autoimmunity is in the mix, but you don't have to have antibodies showing for this to be your pattern. Possible drivers of underconversion, again, inflammation. We want to look at our gut health. We want to look at systemic inflammation and environmental triggers. It can come from liver dysfunction because a lot of the T4 to T3 conversion is happening in your liver. Gut dysbiosis and infections can drive this pattern because conversion of T4 to T3 also depends on a healthy gut microbiome. High cortisol or chronic stress, and sometimes even low cortisol, can drive underconversion because your body is just trying to get you to slow down. Nutrient deficiencies, again, can come in here because your body's like, I don't have enough nutrients to make what I need, so let's just slow everything down. And then if you are not active at all, don't get any exercise, or conversely, if you are overtraining, that can cause this pattern because movement helps with conversion, but too much movement is a stressor and can raise your reverse T3. And lastly, low-calorie diets or super restrictive diets can be a huge factor in underconversion. And I see this with so many women because we are taught through diet culture that we should be eating like 800 to 1200 calories a day. And that's not true. We need calories for our body to be able to have and make energy. And if your body senses that you are starving, you don't have enough calories to run just basic body processes, it's going to slow you down however it can. And a lot of times that's like, I'm going to throw out some reverse T3 so that your cells have zero energy because we don't have energy to live. Some lifestyle and diet support tips for underconversion. We want to eat a nutrient-rich diet that supports conversion. We need our selenium, we need our zinc, we need our iron, we need enough protein, and we need enough calories. We want to support our gut health with fiber and fermented foods if they are tolerated. If you have histamine issues, you may not be okay with fermented foods since a lot of them are high histamine. We also want to work on balancing our blood sugar, which helps reducing inflammation. The key to that, I tell everyone, just eat protein, fat, and fiber with every meal and snack. Make sure those 3 things are consistently there. Don't eat carbs all by themselves, or your blood sugar is going to be on a roller coaster. We want to include some consistent moderate movement, like just walking, gentle strength training, a little bit of cardio to signal the body that it's safe to produce energy. But conversely, don't overtrain. Prioritize rest. Manage your stress. That helps bring down your cortisol. And if you are in an under conversion pattern, fasting is not the right approach right now. You want to focus on stable blood sugar from until you get up, and sometimes like 30 minutes before you get to bed. You want to make sure that you have adequate calories just to reassure your body that you have enough energy available. A lot of women wake up in the middle of the night and don't know why, and that can be because your blood sugar has tanked and your body sends out this burst of cortisol because it wants to wake you up, because it's like, oh my gosh, we're starving again, go get some food. You might not even feel hungry because that signaling has been messed up. But overall, if you eat a nice little blood sugar balancing snack before bed, again, protein, fiber, and a little bit of healthy fat, that can stabilize your blood sugar all night so that you're not having those 2, 3, 4 a.m. wake ups. Okay, back off my soapbox. So under conversion, like I said, you need stable blood sugar and enough calories to get you through the day and the night. Digging deeper on under conversion, we might want to look into more blood work, a comprehensive metabolic panel with a GGT to check our liver health and our detox capabilities. We want to look at selenium, zinc, iron, B vitamins, what our glucose is doing, insulin, lipid panels, HbA1c. The glycomark can tell us how our blood sugar has been doing in the last few weeks, whereas HbA1c is more of a longer range, like the last few months. So those are all excellent markers to check. Next, we want to look at gut health with the GI map or gut zoomer, see if there's any infections or dysbiosis going on. We want to look at total tox burden testing, again, for mold mycotoxins, environmental toxins, heavy metals. We can look at how our adrenals and our hormones are doing with a Dutch or a hormone zoomer. And then again, looking at food sensitivities can always be helpful to help identify hidden inflammatory triggers. So long story short, under conversion means your thyroid's making enough T4, your body's not turning it into T3, and so your cells can't use it. This often happens due to inflammation, gut or liver issues, stress, nutrient deficiencies, or restrictive dieting or fasting. We want to support conversion through diet, lifestyle, and test to see what might be causing our body to think that it needs to conserve energy. And by digging down and figuring out that root cause, we can usually figure out how to resolve it. The 4th pattern is autoimmune thyroiditis. Autoimmune thyroiditis is also known as Hashimoto's disease or Hashimoto's thyroiditis, which means that your immune system is mistakenly attacking your thyroid tissue, and it is the most common cause of hypothyroidism worldwide. I think last I looked, it was about 80, possibly more, 80% of people with hypothyroidism do have Hashimoto's. So for lab work, this pattern evolves over time. In the early stages, you'll see the antibodies, TPO, TPAG, elevated, but TSH and your thyroid hormones are still going to look normal. As it continues to progress and your thyroid cells are destroyed, your TSH will start creeping up, but your T4 and T3 can be normal or start to trend low. Once it's advanced and more thyroid tissue has been destroyed, your TSH will be high and your T4 and T3 will be low. And just know that sometimes a transient hyperthyroidism can occur. As your thyroid cells are damaged, they can leak out stored hormones before they burn out totally. So all of a sudden, your body gets this huge influx of thyroid hormones. So you will have hyperthyroid lab work and symptoms briefly, but then it can go back down to hypothyroid or normal and flip-flop around for a while. A lot of people experience that, and it's like, what the heck is going on? So if that happens and you happen to draw labs, while that's happening, you'll see a low TSH and your T4 and T3 high, but then it'll change. So again, that lab pattern, TSH normal at first, then it goes high. Free and total T4, normal at first, then low. Same with free and total T3, normal at first, then low, and your antibodies are going to be high. Possible drivers of autoimmune thyroiditis. There are a lot. Like I said, I wrote my thesis on this, so I could talk about this for days, but I will try to keep it brief. The leading theory on autoimmunity is that 3 factors need to be present. You need a genetic predisposition, you need a leaky barrier, usually skin or gut. It's usually gut, but sometimes it can be skin. Like if you have eczema or psoriasis, you can get bacterial triggers to come in through your skin. And then you also need a trigger. A trigger is something that can confuse or overstimulate your immune system. Those can be things like gluten or other food sensitivities, acute infections like COVID or the flu, chronic infections, Epstein-Barr, Lyme, parasites, bacterial infections, candida, environmental toxins like mold or chemicals or heavy metals, hormonal shifts. Many women end up developing autoimmune thyroiditis either during or right after pregnancy or during shifts like puberty or menopause. And then also stress or trauma, even long-term stress, even stress on your body from a long-term standard American diet can be your trigger. So what can we do about autoimmune thyroiditis? I have a whole course on this, but I will condense it down to the very most helpful things that I can think of. And first off, for anybody with autoimmunity, my number one piece of advice is go gluten-free, 100%, no gluten. You want to eat an anti-inflammatory diet, and gluten is inflammatory for everyone. Everyone on the face of the earth, gluten messes with your gut. A lot of people aren't super sensitive to it, so your body can keep up and repair that. But if you have autoimmune disease, odds are your body is even more sensitive to it. Plus, gluten has a similar protein structure to thyroid cells. So if your immune system sees gluten and reacts to it, it also thinks your thyroid looks like that foreign piece of gluten that wasn't supposed to be in the blood. So then your immune system is like, oh, let me attack this too. So getting rid of gluten is key. We want to support gut repair with nutrient-dense foods because a leaky gut is a huge trigger to your immune system. We want to stabilize your blood sugar. That also helps us reduce immune activation and reduce inflammation. Prioritize stress management. We want to get really good sleep. Those can all help calm down our overactive immune system. Reduce your toxin exposure. Use clean products, filtered water, filter your air. Eat organic. If you have mold, get out of mold. If you need medication, you're going to want to work closely with your provider because depending on how far along the tissue damage is, a lot of people will need thyroid replacement medicine for the rest of their life. But reducing your triggers and healing your gut and calming down your immune system can improve your symptoms and your long-term health so much, and you might be able to minimize your medication. We also want to note that antibodies, even if you are 100% on point with diet and lifestyle, antibodies may never go back down to 0, but that's okay. Our goal is to reduce inflammation and calm your immune system and get them as low as possible. As inflammation decreases, you might see your TSH go up temporarily. So don't panic. If that happens, that is actually a good sign that your brain and thyroid are starting to communicate again, and that communication is waking back up. So just a little thing to throw in there because I think a lot of people get freaked out when they see that, but it's actually a good thing. So digging deeper into autoimmune thyroiditis or Hashimoto's, for blood work, we want to look at inflammatory markers like CRP, homocysteine, ferritin, and ESR. Autoimmune markers, we might want to look at ANA or other autoimmune markers if we think that there might be other autoimmune diseases at play. GI map or gut zoomer for gut infections, dysbiosis. We want to see if the gut is leaky, which it almost always is. My mentor always said, if you have an autoimmune case, you have a gut case. Total tox burden testing, looking at mold, environmental triggers, heavy metals. Dutch or the hormone zoomer for cortisol and stress hormone patterns. the MRT food sensitivity test again, or the Vibrant autoimmune Zoomers to help identify some inflammatory triggers for your personal immune system. And then we can also look at some infection panels like Epstein-Barr and Lyme and co-infections to see if that's part of the issue that is triggering your immune system and keeping it so overactivated. So long story short, Hashimoto's is an autoimmune condition where your immune system is attacking your thyroid tissue. It evolves over time. It often starts with normal hormones and only the antibodies being elevated, and progresses as those thyroid cells are destroyed. Healing from Hashimoto's focuses on reducing inflammation, repairing your gut, calming your immune system. There's a lot of other things that go into it, but those are really key. And just know medication may still be necessary, but there are so many things you can do to calm down your immune system and feel better with Hashimoto's. Okay, next, pattern 5 is hyperthyroidism. In hyperthyroidism, your body is making or receiving too much thyroid hormones. Hyperthyroidism can be caused by too much thyroid medication. If you are over-medicated, you can go hyperthyroid. It can be caused by excessive use of thyroid glandular supplements. A lot of thyroid supplements actually have some animal thyroid gland in there that contain T3 and T4. If you are over-supplementing with those, you can cause hyperthyroidism. Rarely a thyroid adenoma, which is a nodule on your thyroid that actually produces hormones on its own, can cause hyperthyroidism, but that is very rare. And then there is also an autoimmune condition called Graves' disease. In Graves, the immune system itself produces antibodies, TSI, that stimulate the thyroid directly. So suddenly your immune system is telling your thyroid what to do instead of your brain. So a warning, if you have hyperthyroidism, you need to be having a doctor oversee your care because excess thyroid hormones can affect your heart and your nervous system. So if you see this pattern, make sure your doctor is aware and is doing something for you about it. So the pattern for hypothyroidism is a low TSH. Free total in T4 are going to be high. Free total in T3 are going to be high. The TSI antibodies may be high if autoimmunity is the cause. Possible drivers or root causes of hypothyroidism, again, are autoimmunity, Graves' disease. Like we talked about with Hashimoto's, autoimmunity is thought to be a result of genetic predisposition, a leaky barrier, skin or gut, and then a triggering event like infection, trauma, stress, toxicity. It can also be caused by overmedication with thyroid hormone, over-supplementation of thyroid glandular products, or rarely that thyroid adenoma, the nodule that produces thyroid hormones. Supportive strategies for hyperthyroidism. First of all, again, please work with a doctor to adjust your medication or supplements if over-medication or over-supplementation is the cause. If Graves' disease is the cause, then conventional treatments such as medications, radioactive iodine, or thyroid removal are usually required. And you still want to support your body by reducing inflammation, eat your anti-inflammatory diet, avoid any foods you're sensitive to, lower your toxin exposure, eat a lot of antioxidant-rich foods to buffer the excess oxidative stress that all that excess metabolism is going to cause. Digging deeper into hyperthyroidism, we're going to want to look at the TSI antibodies to confirm or rule out Graves' disease as the cause. We would want to look at a CMP to monitor our overall health and inflammation, MRT food sensitivities to determine our immune system triggers, total tox or other toxin testing for chemical mold or heavy metal burdens, the GI map or the gut zoomer to check for leaky gut, dysbiosis, or infections. So I just wanted to highlight that hyperthyroidism isn't a wait and see kind of condition. It does need medical management to protect your heart and your nervous system. But if we address inflammation, toxins, and immune dysregulation, that still matters. And especially if it is Graves' an autoimmune case, that can be very helpful, even if medical treatment is still necessary. So overall, hyperthyroidism means that your thyroid hormone levels are too high, either from Graves' disease, which is autoimmune, or from too much meds or too much supplements, or possibly a thyroid adenoma. Medical care is essential. Root cause support, can help by lowering inflammation and calm the immune system. So, second to last pattern, and thanks for sticking with me. I know this is getting very long. So, elevated thyroid binding globulin. Again, like I said, I like to think of thyroid binding globulin as the little bus that takes your hormones to work. So, TBG is a protein that carries thyroid hormones in your blood. When it's elevated, more hormones are stuck to your protein and can't get off to do the job at your cell. So your total hormone levels may still look fine if you look at your total T4 and T3. So that means that your brain thinks levels are okay and doesn't trigger any more TSH. The problem with that is without that TSH, it doesn't stimulate your thyroid to make any more hormone, and then your free hormone levels are low, so there's not enough at your cells to get the work done. So for a little analogy that I find helpful when thinking about TBG, we want to think of each TBG molecule as a bus transporting thyroid hormones to work. When there's too many buses, the hormones get all comfy. They don't have to get off and go to work to make room for other workers to get on the bus because there's plenty of seats. So they just fall asleep and ride around all day, stuck in those little buses, those little proteins in our bloodstream, and that leaves the cells starved for their workers, the free T4 and free T3. So the employment agency, aka your brain, doesn't send out a call by raising TSH for more workers because on paper, there's enough workers out there. The total T4 and T3 is fine. The problem is they're stuck on the bus instead of actually going to work. So the job of making energy in your cells is not getting done. So that's my little bus analogy. Hopefully it was helpful. You guys can let me know. The pattern, if you have elevated TBG, your TSH is going to be normal. Your free T4 and your free T3 are going to be low, remember, because they're bound up on the bus. They aren't free to go to work. Your TBG is going to be high, and your total T4 and T3 is going to look normal, or maybe even a little bit high because there's so many guys just hanging out on the bus and it's counting everything. Possible root causes or drivers of high TBG are high estrogen, either from birth control pregnancy or hormone replacement therapy, from liver dysfunction, which can affect how well your body is clearing excess hormones, and there are some medications that can cause TBG to be higher. Lifestyle and diet supports for elevated TBG are to support your liver health, cruciferous veggies, hydration, and minimizing alcohol and other toxins that you ingest. That's going to help your liver out so much so that it can process that extra estrogen. We also want to reduce estrogen exposures. Plastics and conventional personal care products have a lot of xenoestrogens that can bind to your cell's estrogen receptors and block your actual estrogen from getting in. So your body has excess estrogen, but nothing to do with it. You also want to make sure that your blood sugar is balanced. That helps support your weight stability, and because adipose tissue does create more estrogen. And you want to talk with your provider about medication or hormone therapy adjustment if that might be the problem. Digging deeper, we want to look at blood chem with liver markers, hormone testing, either the Dutch or the hormone zoomer are the ones I like to use, and then the GI map or gut zoomer because gut health does tie also into hormone metabolism. So TLDR, high TBG means your thyroid hormones are bound up and unavailable. Estrogen excess and liver health are the big drivers of having elevated TBG. Okay, last pattern, low TBG. When TBG is low, remember TBG is the protein that carries your thyroid hormones. So if TBG is low, there aren't enough binding sites on the protein to carry your thyroid hormones smoothly through the bloodstream. So then you have more hormone floating freely. But even though there's a bunch of free hormone in the blood, that doesn't mean it's getting used by your cells. Too much free hormone all at once can overwhelm the system, and it actually reduces the sensitivity of the cell receptors, so your cells stop taking the hormones in. At the same time, your total hormone levels can look normal. So again, your brain isn't going to adjust your TSH the way you would expect it to. So things are all mismatched and messed up, and labs look really confusing, and people have a lot of symptoms even though they have a lot of free hormones. Let's talk about the lab pattern real quick, because this is why it's so confusing. Your TSH is normal. So your brain's like, yeah, we got enough hormone floating around. But then your free T4 and free T3, the hormones available to work on your cells, are high. So you would think that would mean you would have extra energy. But no, your total T4 and T3 are normal or low, because everything's getting mucked up in your cells in one spot are like, I got too much, I don't need any more. And the rest are like, where's mine? They didn't get here. So here's the little analogy for low TBG. This one's a little bit different because the bus analogy didn't quite work. But we're going to think of low TBG as a restaurant with too few waiters. Okay, in this restaurant, the kitchen is your thyroid. It's making your meals, your hormones. And the head chef, your brain, sees that the right amount of food is being prepared overall. So that's your total T4 and T3. But without enough waiters to deliver meals evenly, some tables, some cells are going to get overloaded with food. Say there's like one waiter and he's like, I give up. I'm just going to put this all on this table and like somebody will be happy. So that one area, that one table of diners has a ton of food. They eat all they want, but then there's a bunch of food left over just sitting there and they're like, I'm not hungry anymore, so I'm just going to let this sit here. So then all this food is wasted, but then other tables don't get any food and they're still hungry. So on paper, it looks like the kitchen did its job. The chef doesn't change the orders any, AKA your brain doesn't change the TSH levels, because enough T4 and T3 was out there. But a lot of the diners, AKA your body's tissues, aren't fed properly because they didn't get the food. The food was all clumped over there on that one table, and the rest of the tables didn't get any. On labs, this is going to look like normal TSH, high free T3 and free T4, low TBG, and then your total T4 and T3 is either going to be normal or low. Some drivers or root causes of low TBG are insulin resistance or high blood sugar, PCOS or high testosterone, and androgenic medications, which are steroids, DHEA, and some hormone therapies. Lifestyle supports for low TBG are to support liver health with cruciferous veggies, hydration, minimizing alcohol and other toxins, balance blood sugar with protein, fiber, a little bit of fat, and stable meals, and then incorporate exercise to improve your insulin sensitivities. To dig deeper into why you might have low TBG, we want to look at blood chemistry with liver markers, also looking at your blood sugar markers like fasting glucose, insulin, HbA1c, or the glycomark, hormone testing like the Dutch or the hormone zoomer, and then the GI map or the gut zoomer, because gut health ties into hormone metabolism like we talked about before. So overall in this pattern, low TBG means hormones are too free floating, and it's usually linked to blood sugar issues or high androgens. To fix this one, the most important step is really to stabilize your blood sugar, and then to also look at what your hormones are doing and figuring out how to stabilize your hormones. So thanks for sticking with me. I know this was really long, but I feel like understanding all of these hormone patterns can help so much when you go to your doctor and you know something's not right and you're still getting told, no, everything looks fine. So hopefully this will give you some starting points to open up some conversations with your practitioner, maybe dig a little deeper with the blood testing labs that I suggested. And if you notice some of these patterns, try some of those supportive lifestyle and diet strategies and see if things improve. If you would like to work together to dig deeper using some of those functional tests I talk about, or to learn more about my Back to Balance program, it is my course that walks you through the root causes of Hashimoto's and gives you a lot of science-backed strategies, including diet, lifestyle, and supplements. on how to actually feel better. Right now, Back to Balance is available as a self-paced course. And I also offer a full support package that includes some of the functional tests that I mentioned in here. So feel free to reach out. You can email me, reach out on social media, or book a free clarity call if you'd like. Hopefully you found learning about all these thyroid blood lab markers valuable so that you can use these patterns to figure out what's really going on and driving your symptoms so you can finally feel better.